Healthcare support team. Technologists and technicians. Technologists and technicians have a technical role in diagnosing or treating disease. They work in a variety of settings. Examples of technologists and technicians include laboratory technologists, which help providers diagnose and treat disease by analyzing body fluids and cells. They look for bacteria or parasites, analyze chemicals, match blood for transfusion, or test for drug levels in the blood to see how a patient is responding to treatment. Most lab tech positions require a 4-year bachelor's degree, and some states require a license. Radiology technologists, also called radiographers, help providers diagnose and treat disease by taking x-rays. For some procedures, technologists make a solution that patients drink to help soft body tissues can be seen. Radiology technologists can specialize in computed tomography or CT scans, magnetic resonance imaging or MRIs, or mammography. Most radiology technologists complete a 2-year associate degree, but some have a 4-year bachelor's degree or a certificate, which takes 21 to 24 months. Licensing requirements vary by state. Pharmacy technicians help pharmacists prepare prescription medications. They also provide customer service and perform administrative duties such as to take prescription requests, count pills, label bottles, and prepare insurance forms. There are no standard training requirements for pharmacy technicians, but some states require a high school diploma or its equivalent. Some pharmacy technicians are trained on the job, and others complete a certificate, which takes 6 months to 2 years. Licensing is not required, but in most states, pharmacy technicians must register with the State Board of Pharmacy. Therapists and rehabilitation specialists help people recover from physical changes caused by medical condition, chronic disease, or injury. Types of rehabilitation specialists include physical therapists, occupational therapists, and speech therapists. Occupational therapists help patients perform tasks needed for everyday living or working. They work with patients who have physical, mental, or developmental disabilities. This includes stroke patients who have lost function on one side of their body, heart or lung disease patients with activity or breathing limitations, or diabetes patients who have had a limb amputated. Occupational therapists help clients find new ways to dress, cook, eat, or work. They may visit patients in their home or workplace to find adaptive equipment or teach patient new ways to do things. Occupational therapists have a master's or doctoral degree and are licensed by their state. Physical therapists help patients when they have an injury, disability, or medical condition that limits their ability to move or function. Physical therapists test a patient's strength and ability to move and create a treatment plan. The goal of treatment is to improve mobility, reduce pain, restore function, or prevent further disability. Physical therapists may treat patients who have had an amputation, stroke, injury, or chronic disease. Physical therapists are required to have a license and may have a 2-year master's or a 3-year doctoral degree. Respiratory therapists treat and care for patients with breathing problems. They work with all types of patients, including premature babies, older people with lung disease, or patients with asthma or emphysema. Respiratory therapists require an associate's degree, but many have a bachelor's degree. A license is required in most states. Speech therapists are also called speech-language pathologists. They work with patients who have problems related to speech, communication, or swallowing. These problems may be caused by cancer, stroke, or brain injury. Speech therapists tailor care plans to each patient's needs. If a patient has a problem speaking, the therapist may teach them to use communication devices sign language, or alternative ways to communicate. For problems swallowing, they may teach patients to strengthen muscles or new ways to swallow food and liquids without choking. Most states license speech-language pathologists and require a master's degree. Emotional, social, and spiritual support. The team members we have talked about so far provide physical support. There are many healthcare team members who provide emotional, social, and spiritual support. Mental health professionals. Mental health professionals help with the emotional aspect of living with a chronic disease. Psychiatrists are medical doctors who diagnose and treat mental, emotional, and behavioral disorders. This includes disorders of the brain, nervous system, and drugs or chemical abuse. Psychologists deal with mental processes, especially during times of stress. They are not medical doctors, but have a Doctor of Psychology or a Doctor of Philosophy degree. Most psychologists do not prescribe medicine, but treat patients with counseling and psychotherapy, talk therapy. Social workers. Social workers in a clinical or hospital setting help patients and families cope with emotional, physical, and financial issues related to an illness. Depending on a patient's need or a social worker may help coordinate services such as housing, transportation, financial assistance, meals, long-term care, or hospice care. Social workers may also refer patients to mental health professionals for emotional or substance abuse support. Social workers have a master's degree and are licensed by the state. Clergy. Religion or spirituality can be important for people coping with illness. Members of the clergy, such as priests, ministers, and rabbis, provide patients with spiritual support. They may listen to patients, counsel them on religious or spiritual philosophy. They may also perform religious sacraments or rites, such as blessings, communion, or last rites. For nearly 90% of hospitalized seriously ill patients, in one study indicated that religion helped them cope. Patients in other studies indicated that religious belief and practice helped prevent depression. Administrative and support staff facilitate patient care within the hospital system. Administrative and clerical staff coordinate and facilitate patient care. They schedule appointments, answer phones, greet patients, keep medical records, handle medical billing, fill out insurance forms, arrange for laboratory or other diagnostic services, and handle financial records. Some job titles of administrative or clerical staff include clinic coordinator, administrative medical assistant, medical records specialist, medical billing specialist, financial counselor, schedule. Volunteers are an important part of the healthcare team. The duties of volunteers can vary widely. Volunteers may have administrative duties and work in reception areas or gift shops. In a medical office, they may file documents, answer phones, help with health screening, or deliver documents to various parts of the hospital. Advanced volunteers have special training and may work closely with patients under the supervision of a nurse or doctor. Community health workers and patient navigators play an important role on the healthcare team. Community health workers or outreach workers work in community settings. They link patients to primary care providers, health information, health screening, financial assistance, or transportation. Patient navigators usually work in a clinic or a hospital. They work closely with patients to reduce the barriers that keep them from getting health care. Barriers may be related to low income, transportation, childcare, language, or ability to read forms and understand the healthcare system. The job duties of a patient navigator can vary. Some patient navigators work with patients through the screening and diagnosis phase. These patient navigators may help healthcare workers with some college and are shown in the may work with patients throughout the treatment phase into survivorship or health maintenance and end of life. These are usually very experienced patient navigators, nurses, or social workers with a bachelor's or master's degree. Different chronic diseases require different healthcare team members. For example, a patient with cancer may see a primary care provider, a medical oncologist, an oncology nurse, and a radiologist. Many others may also be involved in their care. Chronic disease team members include cancer specialists, diabetes specialists, heart and pulmonary disease specialists.